As many women set health goals at the start of a new year, one important issue often gets overlooked: urinary tract health. UTIs affect millions of women every year, and for many, they're not just a one-time problem. Joining us to break down what women need to know to protect their urinary health and feel their best is board-certified OB-GYN and medical advisor at Uqora, Dr. Alyssa Dweck. Thank you for being with us.
Thank you for having me.
Now, why are UTIs more common in women than men?
UTIs are much more common in women, and in fact, there are 11 million cases of UTIs every year in the US. But women are specifically at higher risk because they have a short urethra. In other words, it's about their unique anatomy. Short urethra means bacteria have an easier time getting transmitted into the urethra, up to the bladder, and causing an infection.
Now, for women who get UTIs repeatedly, what does prevention look like beyond just treating infections as they happen?
Sure. Well, look, 60% of women are going to have at least one UTI in their lifetime, and many will have a recurrent infection. We recommend a couple of simple tips. So, for example, wipe front to back when toileting. Hydrate really well every day to help flush the urinary tract in general. Urinate after sexual intimacy for sure. And then consider an over-the-counter supplement that contains whole fruit cranberry powder in a clinical dose, such as that found in Uqora Flush Advance Plus, in an effort to lower the risk of recurrent urinary tract infection in healthy women. In fact, this supplement also has dual action because it also contains D-mannose, which helps quickly to flush the urinary tract system as well.
Now, doctor, when UTI symptoms start, what can women do right away, and when should they see a doctor?
Sure. Well, women who have ever had a UTI will be all too familiar with symptoms of urgency, frequency of urination, pain when you go to the bathroom. In general, hydration immediately and initiation of an over-the-counter supplement that contains this clinically effective whole fruit cranberry powder is super effective. Women should absolutely check in with a healthcare provider if they're experiencing fever and chills, back pain, blood in the urine, so they can get checked out and worked up.
Doctor, you mentioned this earlier. We hear a lot about cranberry for urinary health. What does the science actually say?
Sure. Well, there's quite a bit of research on cranberry. In fact, it is recommended as a preventative measure in clinical dose by the AUA, the American Urological Association. It has something in it called PACs, which simply make the bladder very slippery to bacteria that cause infection. In this way, it helps to lessen the chance of infection, particularly recurrent infection in healthy women.
Now, where can our viewers go for more information?
Please visit us at uqora.com. We have plenty of information, not only about product offerings, but about urinary health in general, and also a big community.
Doctor, thank you so much for joining us today. We really appreciate it.
My pleasure. Thank you.
Thank you.